And right now, next we will turn to the supportive care in oncology. Now, please welcome on stage Professor Hsiang-Lin, Director of the Division of Colorectal Surgery in KMUH. He will present the role of home parental nutrition in advanced cancer patients, a critical element in maintaining nutritional status and improving outcomes for patients with advanced stage disease. We will welcome Professor Tsai.
Okay. After the traditional medicine and name, I will introduce the home parental nutrition in the cancer patient. Okay. Ladies and gentlemen, good afternoon. I am Dr. Tsai from Kaohsiung Medical University Hospital, Kaohsiung, Taiwan. I am very honored to deliver a short speech here. And the topic of my speech today is the role of home parental nutrition in advanced cancer patients. This is the content of my today's speech. I will divide it into 3 parts. The part 1, I will talk about the prevalence and consequence of the malnutrition in cancer patients. And part 2 is about home parental nutrition support for the cancer patient. By the way, I will briefly introduce the home parental nutrition in our hospital. And the last part, I will talk about the role of omega-3 fatty acid in cancer-related malnutrition. Okay, that is part 1. I will talk about the prevalence and consequence of malnutrition in cancer patients. In the past 42 consecutive years in Taiwan, cancer is always the first leading cause of the death. And among the cancer patients, as we know, the estimated rate of the malnutrition is about 30 to 80%. And up to the 20% of the cancer patients, they died due to the consequence of malnutrition rather than the cancer itself. So, they are the consequences of the malnutrition in cancer patients, which eventually lead to increase the mortality rate and a higher economic burden on the country. In 2024, a published paper which enrolled a total of 356 patients who got the resectable gastric cancer. And from their data, we can see that the role of malnutrition in the patient playing a very important factor to influence their overall survival and disease-free survival. In other words, if a patient will have a malnutrition, they will get worse overall survival and worse disease-free survival, and they are significantly. Next, I will talk about home parental nutrition support for the cancer patient and brief introduce of the home parental nutrition in our hospital. Okay, home parental nutrition, in other words, here is an adaptation of the in-hospital parental nutrition, and it encompasses both the total parental nutrition, TPN, and partial or supplemental parental nutrition, PPN. And what's the end of the home parental nutrition? The major aim is to provide the nutrition and hydration for the patient who are unable to maintain an adequate nutrition status, even though through the oral intake or enteral feeding. So, how about the prevalence of the home parental nutrition is globally? Actually, for example, in Europe and USA, in Europe, the prevalence is about 34 cases per million, and USA, he is 75 cases per million. And the home parental nutrition epidemiology data from Taiwan and other Asian countries is scales. Okay. From some published article, we know the home parental nutrition have some benefit. The benefit include for the selected patient with terminal cancer or malnutrition, home parental nutrition can take us a part of palliative care, and he intend to increase the patient survival and improve the patient quality of life. So home parental nutrition take us a life-saving therapy. By helping the great malnutrition, he can prevent death and from the starvation and dehydration. Also, home parental nutrition can induce in-hospital stay and increase the proportion of care in the outpatient setting. Herein, I will cite two articles on the clinical application of home parental nutrition intervention in the advanced cancer patient. The first article is published in 2022 by our team, and he's focused on the efficacy and safety of the home parental nutrition program intervention for the metastatic colorectal cancer who received the cetuximab plus the chemotherapy as the first-line regimen therapy. And the second article is comparing the home parental nutrition and artificial hydration in advanced cancer patients. From the result of the first article, we found that for the home parental nutrition program, may improve the efficacy and safety. And from their data, we can see that for the home parental nutrition group, they have many benefits clinically. For example, they have a higher metastasis, and they have a longer duration of treatment and longer duration of response. And they have a longer median overall survival. And all of benefit are significant. The second article is comparing the home parental nutrition and artificial hydration. This article is a study which is prospective cohort survival study. They collated different cancer types, and finally, they enrolled 89 cancer patients received the home parental nutrition. We call it study group. And the other is 36 cancer patients received the artificial hydration. We call it the control group. And from their data, we can see for the study group, they have a significant longer survival. And by the country, for the control group, they have a 25-fold risk of mortality than the study group. Next, I will introduce the implementation of home parental nutrition in our hospital. This is the SOP for the home parental nutrition in our hospital. Simply put, from the patient admission to the discharge, a patient who wants to learn the home parental nutrition, we will design a very detailed home parental nutrition program. And during the duration of the home parental nutrition practice, we also use many auxiliary tools to teach and enhance the practice to the primary caregiver. That is one of the characteristics of the home parental nutrition in our hospital. And before the patient will discharge, we the entity nurse will evaluate if the patient needs the home parenteral nutrition home visit or not. If he don't need the home visit, we will regularly arrange the follow-up in our OPD. Initially, maybe the cycle is 7 days. And if the patient condition is more and more stable, where they will prolong to 1 month, one time. But every 7 days, he will come to our hospital for the injection site replacement and care. And the entity nurse also will regular telephone follow-up for those patients. And if evaluate the home parental nutrition home business is necessary, after discharge, the home nurse will call to arrange the initial visit. Regularly, he may be followed by the 7 days after discharge, and then regular visit every 7 days. And the role of the home nurse is to assist with injection line replacement care at patient home. And the role of the entity nurse is telephoned to follow up and to provide ongoing care plan. So in this slide, you can see we have designed many auxiliary tools to help the primary caregiver to practice the home parental nutrition skill. For example, in 2017, we designed a POA education model for the home parental nutrition training. In 2020, we set up a QR code on the back of the practice model to directly link to the training video. Since 2021, we recreate parental nutrition bag to the use for the primary caregiver, and education video is used to the home parental nutrition training. But the home parental nutrition is successful or not, patient selection is a very important factor. If the home parental nutrition would like to be successful, the patient must be under the stable disease, must be motivation and self-care ability, and the primary caregiver is also the other very important factor. Because well-trained and good primary caregiver will support the patient very well care. About the economic burden in Taiwan, if the patient meets the criteria of home parental nutrition policy, they will receive the reimbursement except the stabilization supply and regurgitation fee. This slide is demonstrated the home parental nutrition care process and clinical operation model in our hospital. When a patient he would like to learn the home parental nutrition admitted to our ward, the entity nurse will first evaluate the patient and his primary caregiver, the willingness to learn, and to evaluate the self-care ability and home environment and related precursor of home parental nutrition. And then the wardens were using the POA auxiliary tool and nursing instruction sheet to conduct the health education until the operation is correct. And patient can repeat the practice implementation on the body. Finally, if the patient is prepared for discharge, the entity nurse will check and confirm the technique, operation, and skill. They are all correct, and then will be arranged to discharge. Okay. When the patient come back to our OPD, the NTT dietitian will conduct the nutrition assessment. He included the food intake assessment, dietary hygiene education, and NTT doctor will assess the patient home parental nutrition use at the home, and will discuss the current condition with the patient. That is very important too. According to the injection line needle change, we will arrange every week, come back to our hospital. Okay, so for the home parental nutrition education and training in our hospital, he is a comprehensive education. We have a very detailed and well-trained SOP, well-designed SOP of home parental nutrition. We always use the Porter A auxiliary device model to teach the primary caregiver. And primary caregiver and the patient will receive the well-trained proper hair wash technique and how to adjust the infection rate and how to evaluate the injection site wound evaluation. But the important point is about the medical waste disposal. The medical waste disposal, patient must take over and take back to our hospital and to my specialist for the further treatment. Another very important point is if the patient meets the emergency or have the emergency condition or emergency situation, who is the contact person is very important, and we will tell the primary caregiver and patient himself. From our home parental nutrition practice, we found they have some indirect cost saving from the home parental nutrition policy. For example, after the auxiliary device use, we found in the providing home parental nutrition, he can save the time and from the 67 hours down to the 31 hours. And by the way, for the average hospital stay, after the auxiliary device use, he can save the hospitalization from the 5.4 day to the 2.5 day. That is the common complication of the home parental nutrition in our hospital. The first is electrolyte imbalance. Second is hyperglycemia. And third is catheter-related bloodstream infection. Okay. Based on the duration of home parental nutrition use, for example, short-term or long-term parental nutrition patient, we designed the different monitoring factor for them. For example, for the long-term parental nutrition use patient, we focus on the laboratory parameter monitoring. For example, we will monitor their liver function, their TG level, their glucose control, and electrolyte or fluid imbalance or not, vitamin and trace element level, and metabolic disturbance. Okay, so after use of the auxiliary device, we can find we can reduce the nurse working hour and decrease the hospital stay, as well as reduce the caregiver burden. And the future of the home parental nutrition in our hospital, I think it include, number one, home parental nutrition can minimize the hospital stay and facilitate home care. And number two is he can save intangible costs related to the patient care and quality of life. Last, I will talk about the role of omega-3 fatty acid in cancer-related malnutrition. According to the 2022 ISPN guideline, we know for a cancer patient, the energy intake is recommended 25 to 30 kilocalorie per kilogram per day. And for the protein intake is 1 to 1.5 gram per kilogram per day. And that is very important thing is when, or we say timing of the parenteral nutrition intervention. According to the recommendation, if the patient have less than 50% of the requirement over 1 week, or even the oral intake, calorie intake, reach the 50 to 75% of the requirement, but the duration lasts over 2 weeks. Parenteral nutrition intervention is the recommended. And for the cancer cachexia patient, according to the 2021 ISMO guideline, they recommended accounting for half of the non-protein calorie are recommended. And for the waiting loss cancer patient with the insulin resistance, the recommendation is increase the ratio of the energy from the fat to the energy from the carbohydrate by the 2022 ISPN guideline. And the omega-3 acid clinical guideline, how about is the omega-3 clinical guideline according to the 2021 ISPN guideline? If they suggest if a patient is advanced cancer and undergoing chemotherapy or at risk of weight loss or malnutrition, they suggest supplementation with long-chain omega-3 fatty acid or fish oil to stabilize or improve the patient's appetite food intake. This slide is illustrates the relationship between the omega-3 fatty acid and cancer cachexia. In conclusion, EPA and DHA supplementation can exert a beneficial effect on the cancer cachexia by suppression of catabolic pathway through the NF-kappa B. This is our published article by our team in 2015. We compared the upper GI, we compared the patient with gastric cancer and colon cancer. We used the omega-3 Prof and the NCT as the lipid emulsion. And we would like to monitor since the surgery day to the post-surgery 7 day. We can find that omega-3 PUFA contain lipid emulsion. He is less development of hyperlipidemia. And the other article published in 2024, in this article, he enrolled upper GI cancer surgery patient, and he used the immunonutrition therapy, including arginine, omega-3, or glutamine as the TPN infusion. They confirmed use the immunonutrition, he can decrease or reduce the infection complication about 30%. Also, in the 2022 and other article, he demonstrated omega-3 PUFA supplementation may lower the risk of chemotherapy-induced peripheral neuropathy. That's the last slide. That is my take-home message. 1, up to 20% of cancer patients died due to the consequence of the malnutrition, rather than his cancer itself. Second, malnutrition is significantly linked to a poorly overall survival and increase the risk of post-operation complication. And strangely, NST or NTT and establish a clear SOP can streamline the home parental nutrition implementation. And 4, omega-3 enriched parental nutrition is beneficial in reduce the risk of infection complication, and he is recommendation by guideline. And the last, home parental nutrition improve the quality of life of patient, reduce the health care and the workload, and lower the medical cost. That is very important. Thank you for your attention.